Hi, guys. Welcome back to Sincerely Swan, the podcast where I talk about whatever's on my mind. Today, I really want to talk about why I am leaving nursing and the subject of moral compromise and how that ties into it. So, I have some notes here in my little journal. This just helps me with keeping my thoughts in order because sometimes I will be talking and I just completely forget what I'm saying. I also have my little MacBook here, and I actually really want to give like a special little shout out to my boyfriend because he bought me this for Christmas and I've never had a MacBook before. I remember being in high school and because I went to private school, everybody had a freaking MacBook and I was just like, yeah, I'm gonna need to rent one of the computers from school because I can't afford one. It just feels like I like it so much. I feel so happy and like so loved. And not to say that like it's just because there's material value, but like when you really really want something nice and you're working to try and afford it for yourself and then that just gets taken off your plate because somebody loves you enough to help you, it is really just very sweet and very kind. And when he gifted this to me, he told me that it's because he really believes in what I'm trying to do with this podcast, with my content creation, and trying to find what speaks to me in this life and what my purpose is. This is also going to just help with doing work and editing, and I really appreciate that. So I love you, babe, if you're seeing this. And let's get into it because I have a couple notes on this too, so that's why I'm going to be bringing this up at some point. So, moral compromise. That is, by like textbook definition, when people agree to give up something for the sake of a mutually beneficial outcome. So, say, like, for example, in a partnership, you both give up drinking and try to exercise more prior to having a child because you understand the fact that not only do mom's genetics really impact how the baby comes out and mom's health, but so does dad's. Because, for example, and this is my nursing brain coming out, dads and their health impacts the placenta. It impacts actually much more of the baby's health than we realize, and I think these things are starting to be researched more and more often because everything when it comes to pregnancy is put onto the mom. We got to realize there's two people in this game. Even if one of them is growing all the bones and the things and everything and taking their body to create a whole person, there's still two people in this game. And so both of their health is really impactful. So that's an example for moral compromise. You are both giving up eating out all the time, having junk food, drinking alcohol, smoking, etc., because there's the mutually beneficial outcome of a little life that you could create together. Moral compromise can be beneficial, just like all things, because at its base, seems like a really good idea, right? For a mutually beneficial outcome. However, moral compromise can and has been shown, when out of whack, to impact people's happiness. Their actual morals and beliefs are being challenged on a daily basis because nowadays, especially in a capitalist world, the beneficial outcomes created by these companies always have an impact. And usually they don't always align with exactly what their employees believe in. Because regardless of what you think, sometimes people just work jobs because they need the money. They might not be like, yes, I absolutely love the values of this company, whatever. I have had people that I've known in my life that have gone to work for companies like Palantir and Lockheed Martin, that's the main one, because they know that nowadays being able to afford a home is very difficult and these companies pay a lot for you to compromise your morals. I have experienced this in nursing. And moral compromise and the way that it has basically compromised my own beliefs and my own morals is part of the reason that I'm choosing to leave nursing altogether. Not that I don't believe that it is not a noble profession, but I think that we are very far away from our starting point. You know how they teach us in nursing school all about Florence Nightingale and her beliefs and whatever? She would be shocked and dismayed. First of all, half these units, you can't even open the windows, mostly for like suicide precaution, but like we're not getting any fresh air in there. One of her first things that she did as a nurse was like opening up the windows, bringing fresh air, saying that that benefits healing, which it does. I mean, you don't want to be in a stuffy room as you're trying to heal from like having a leg amputated, right? But we are so far from the point nowadays because at the end of the day, all these companies want is another paycheck. And that is why we are seeing nurses not being paid for the work that they are doing, not being paid enough, that is. Of course, we're being paid, but when you are telling people that their family member might not make it, and that we're doing everything that we can, when you are helping with intubations, when you are helping with putting in central lines, with any of the very difficult things that we do in order to help our patients survive. I'm sorry, but like $33 an hour? Are you kidding? And there's some older nurses that I've spoken to that said like, "Oh, when I started it was like $26 an hour. So this is great." Here's the thing. It might be better than where it was. That doesn't mean it's good. And then on top of that, in this job, we are dealing with moral compromise and moral distress constantly. So much so that it's something that's taught in the schools. It was taught to me in my curriculum, and we are taught to be the ones to fix this in ourselves, as if it's not a problem in the system, when that is like so far away from the truth. Because guess what? Burnout is not because our nurses aren't resilient. Burnout is because our nurses are overworked. It is because our nurses are not machines, because we are human beings and we see suffering on a daily basis and we do as much as we can. But again, 12 hours is only 12 hours, and we go home at the end of the day and it sticks with us, and it's difficult because we are human, because we care. And I say nurses mainly because that's what I am. I am a nurse. That is my scope of work. But I also mean all healthcare professionals. So please, when I say that, don't think that I am ignoring the stress that is put onto doctors, that is put on to OTs, PTs, techs, anyone that is involved in the healthcare field. It is horrible for all of us. And we are all not being paid enough for the things that we have to witness, that we have to endure, and the ways in which we struggle in order to benefit others. When it comes to moral distress, I did a little bit of research on nurses and their moral distress. And it happens very often in the clinical setting, obviously. We have in hospitals very little control over our own ability to practice. Obviously, there is like a scope of practice wherein we have to work, but then there's also hospital policy that we have to follow. And I have found many, many times where hospital policy, yes, is beneficial, it's good, but it seems like nowadays it is more to prevent the hospital from being sued than to actually really help people. And sometimes you will have very good NPs and doctors and nurses and experienced staff members who are willing to challenge that and to say, look, this is not actually working. This is making things way harder. And also, who cares about having water bottles at the desk when we have nothing in our little storage room, when we don't have enough people to work at a unit? And now we are going to really unsafe ratios. I've only ever really worked in the hospital setting. I've experienced outpatient clinical settings and more like holistic clinical settings through my actual clinicals in nursing school. And that's why I do have a little bit of experience and frame of reference for that. But having only worked really in hospital settings, in ICUs, and in very specialized units, I understand just how much these hospitals are cutting corners and pushing us to our very limit in order to make profit, in order to get as many patients in and out as possible. There is a very high prevalence of moral distress in nurses. You see this in the clinical setting, and it has to do with ethical conflicts occurring in their day to day work, not just over a long period of time. Because guess what? We sometimes don't have the same patients every day. We have varying situations that happen throughout the entirety of our shifts, and in that, our own morals and values can be questioned. And I have seen this from the scale of, like, say, a very religious nurse who is very stuck in their morals and their values having to treat patients who are completely opposite. And the bickering that comes from that can be really crazy. It's not even just that. But then there's also, for example, some nurses who are undergoing very difficult home situations and then are put in the path of a patient that is either relevant to their situation. For example, say a nurse who has recently been assaulted gets put with a patient who has a history of domestic violence or who has a history of sexually assaulting women, but you have to care for your patient, so you have to put that aside. That is not easily done. Just because we are nurses doesn't mean that this just magically goes away. For example, also, a nurse that may have experienced prior abuse from a patient when returning to work can be put with a patient who is violent. Their management maybe doesn't care, their charge nurse doesn't care, and it starts to feel like we are in a system that is just churning us out because it knows that it can. That is where I've had a lot of hardship in my own practice. Yes, there is a degree of having to accept that you cannot cater to everyone, but again, we are being shown actively. So many of these hospitals really don't seem to care about their workers. I mean, for example, take the nurse that was here in Florida, almost beaten to death by a Baker's Act patient. Baker's Act being they knew this person was violent, either a harm to themselves or others, and still the situation occurred. And who did the hospital blame? Not the systems put in place that were not actually helpful at all. It shifted blame onto the nurse. It shifted blame onto the person who is putting themselves at risk in order to help someone. These things should piss us off more than the fact that our paychecks are small. These things should piss us off because when you go to work for an employer, you should be guaranteed safety. I don't think that is a unreasonable demand. And a lot of these companies, you'll come into them and they'll talk about their workplace safety management. But when it comes down to it, what do they actually do? That is what we need to be looking at. That is what we need to be critical about. And that is where we need to realize, okay, this hospital cannot prioritize this. In times of stress and duress, they're shifting blame onto the people that help them be where they want to be, that help them make all of these profit incentives happen. Again, I understand because life is rough. It's hard. You're like, well, I need a job, so I might as well still work at this place. And in that, we're compromising our morals. We're compromising our beliefs. We are telling them that it is okay, that, you know what, it happened to that nurse, but it probably won't happen to me, right? Until it does. Almost every single nurse that I have worked with has been assaulted by a patient, or at least verbally assaulted. I think that happens. I mean, that's like 100 times out of 100 gonna happen. The fact that we are now being put in this place where we need to accept that and say, well, like, that's just the state of things. And so you kind of just have to deal with it. That should never be okay. And that's a way that we are experiencing moral distress, moral compromise. A violent workplace should never exist, ever. And we need companies that actually care about their workers now more than ever. And if that means we all have to go on strike or leave or petition for a union or struggle in order to get there, I truly think it is better than doing nothing at all. And I understand we have families, we have lives, we have bills, but nothing will get better if we don't try. Moral distress is, I think, what's really at the core of the current situation in nursing right now. We hear a lot about burnout and job dissatisfaction, high turnover rates, and we seemingly do nothing about it. And the answer's right there. Our nurses are overworked. Our medical staff are overworked. Really high levels of moral distress are related to the things that we see very commonly in the healthcare system. Compassion fatigue. This is something I've personally experienced. I started nursing with a very realistic idea of what it would be. I mean, I went through clinicals, I did all of the testing, I worked incredibly hard to get to where I am. And I worked even harder still afterwards because when you start as a nurse, you don't really know much. School teaches you barest of minimums, but it doesn't teach you how to interact with the patient who is struggling with addiction and just needs somebody there and wants somebody to explain to them what exactly is happening to them and what you're going to be doing. Nursing school does not teach you how to be there with parents when their child passes away and how to help children or adults or people without their family members present how to pass on in a way that is dignified and peaceful. Nursing school does not teach any of that. We learn that on the job, and it is incredibly difficult. It's incredibly rewarding, yes, because there's so much value in being there for people in their hardest times of their life, but there is always a balance. To be able to do such great things, we have to experience such terrible situation. And that is where we find ourselves burnt out and unhappy, and oftentimes not prioritizing ourselves. We go home after long shifts and we sleep our days off, and then we start it all over again. Especially for night shift. And I was on night shift for 2.5 years, just about, and it was battle. Let me tell you, dealing with that and depression and anxiety and trying to figure out my life and being just a regular 22-year-old and just trying to get it together, incredibly difficult. And now being past it, I see just how much poor management and the hospital system impacted all of this. I personally started experiencing burnout really heavily in this past year. I switched from night shift to day shift, thinking that would help. It did not. I would have multiple crying episodes during my shifts. I was terrified of making mistakes because even though a lot of companies will be like, you're human, you make mistakes, that's the thing. When you are seeing nurses who make mistakes and it costs them someone else's life, I'm sorry, that's terrifying. I would never want to be in that position. But then again, when you look at the nurses that do make the mistakes, they're overworked, they're tired, there's not a good balance because the system is taking advantage of us. It's all tied together in this terrible, like, gumbo of bullshit, and it is hard to become a collective and to look at each other and realize that change needs to happen and to be able to enact change when we're already tired. And maybe that's the whole point. Maybe that's how they want us to be. That's why I'm telling you, you should be angry and you should be trying. And I don't care if you are the only one doing it. Please, for the sake of the rest of us, because we are all tired and we are all burnt out and we are all just looking for the next thing that can just give us a little bit of joy and a little bit of purpose. Sometimes that is our patience. Sometimes that's learning to be with ourselves. But that's why we shouldn't give up. And I will always, always talk about my experiences with this job and how it has brought me to my lowest of lows and how it has made me stronger and more resilient, but how it has made me angry because our management does not care. And I say this as a very general because I know that whoever is hearing this, you know that. Doesn't matter what hospital you're in, what clinic you're working at, doesn't matter where you are. Your management doesn't care. The CEOs don't care. They say they do, but who's there with the patients when they're dying, when they're suffering, when they're going through the worst parts of their lives, when they hate you for trying to help them? They're not there. They don't see that. You do. You know. And you know just how difficult it is. And this is why we need to come together and work even harder than we ever have to make change. I get very worked up when I talk about these things. It's just been a long journey for me. I really had such a different expectation when I came into nursing about what it would look like, and I really thought that the purpose alone was enough, and it's not. I really thought that helping other people is incentive alone, and it's not. Because you can't help other people when you're being destroyed from the inside out, when you are being told to put aside your beliefs and just put your nose down, put your head down, and get through it. There's a lot of things that need to change in healthcare, and they won't start unless we start accepting the fact that things are not okay and that maybe we're not doing enough to contest this. So if you get the chance, I don't care if it's in your next staff meeting, if you want to talk to a union representative, if you need to stand up for yourself when you have an unfair assignment, I want you to take that chance every single time. And it's going to be scary, and honestly, depending on how you go about it, you could lose your job. That's something you need to be prepared for. But in order to have change, we need to be prepared for these things, and we need to be willing to do them anyway. I think I kind of went all over the place with this, but I hope that in some sort of way I've gotten to a good point. I'm trying to see if there's anything really that I have in terms of like my notes here in regards to this. At the very basis of it is just, you know, you're being overworked. You know you're being put into impossible positions, impossible situations, and being told that this is just how it is because we don't have enough people. This is when we need to fight. This is when we need to come together and realize that things can be better. In fact, things are better for a lot of other people, so why not for us? We just need to find our voices collectively. I'm asking, even if you're a patient, honestly, and you see the way that your nurses are running around and they're not being able to adequately help you because they have so many patients, you need to say something. Complain. Complain. Complain about the fact that there's just not enough people. We all need to do better as a society. There are a lot of things that need to be addressed, of course, and I can only speak about the things that I'm currently experiencing because that's kind of like the scope of my life, right? I know the healthcare system. I know what it's like to be a nurse. I know what it's like to deal with burnout. I know what it is like to deal with compassion fatigue and to struggle with depression and anxiety about my job. But I also have hope for what it could be. And the healthcare system needs a lot of change, but I believe that we can do it. And even if that means that all you do is talk to your friends about unionizing, it's just bring it up. And I hope that in my lifetime I can see true change. Not just in this situation, but in the whole mess that is our world right now. Anyways, that's all I really have to say to you guys today. I hope you have a wonderful day, night, whatever it is. I love you very much, and I will see you in the next one. Bye.